introduction, it's an overview about leukemia. Then we'll have another presentation on acute leukemias and a third presentation on chronic leukemias. ما عرفت الناس الوقت شنو، لكن أنا أتوقع إنه we may need some break between these presentations. Okay. leukemia بالعربي يسموها إبيضات الدم، يعني making blood white. طبعا الاسم جاي من لأنه شكرا أنه the predominant cells are white plus leukocytes. لكن as we shall see, this is not absolutely true. You can have other cells other than white cells involved in leukemia. Leukemia is just malignancy of hemopoietic cells. And it's, as it appears, it's a clonal or malignant proliferation of hemopoietic cells. And as we all know, hemopoietic cells are found in the bone marrow. And therefore, leukemia by organ is a disease of bone marrow. And this is why the diagnosis of leukemia entails a bone marrow examination. It can be suspected clinically, it can be suspected from peripheral blood picture, but the diagnosis has to come out of bone marrow examination. So when it comes to etiology, like any other malignancy disease, leukemia is caused by a number of causes, and there is not a single cause that causes leukemia. Just like any other malignancies, you need a number of causes, a number of factors to collaborate over a long period of time, then to produce a disease. And therefore, it's a constellation of combination of both genetic and environmental factors. وبالتالي when we are talking about etiology, there are host factors. There are familial occurrence، يعني في ناس في أسر معروفة إنه بتجي بالleukemias, a number of the members of the same family they get the disease, and this just reflects the genetic component. When it comes to the environmental component, then there are a number of factors that are known to be risk factors for leukemia. Chemical agents زي ما هنعرف بعضها, drugs, microbes, radiation, and immunological deficiencies. طبعا radiation is important. كلنا عارفين that most of survivors of the atomic bomb of Hiroshima and Nagasaki, they developed leukemias. يعني there might be occupational exposures. الناس اللي بيشتغلوا في الأشعة زي أخصائي الأشعة، تقنيين الأشعة، الناس شغالين في nuclear industrial plants. There are certain people who are exposed by the nature of the place where they are living. Like one of the most important chemicals is benzene, this petrol benzene. And exposure to benzene is leukemogenic. Now we did a small study here and we published a paper on the hematological changes among الناس شغالين في طرمبات البنزين في مدينة الأبيض. rubber industry، المبيدات الحشرية، certain infections, viral infections, drugs, radiation، كلها might be a risk factor. So like any other malignancy, you need a number of causes, a number of mutation, a number of things to accumulate over time until a threshold is reached, then the disease appears. طيب لأنه it's a number of diseases. Leukemia is not one disease, as you have said, there are a very big number of leukemias. وبالتالي there is a need to classify them. And this classification depends on a number of factors. Like in one of the most important classification is to classify them into acute and chronic. And this depends mainly on type of cell that becomes malignant. And when we talk about acute leukemias, we are talking about proliferation of immature cells. While if we are talking about chronic leukemias, we are talking about proliferation of mature or maturing cells. برضه طبعا nature of the disease onset is different. This is another important factor. Acute leukemias, they start abruptly, they progress rapidly, and they cause disease over a short time. And if they are not treated, they are fatal. They are invariably killing. This is in contradistinction to chronic leukemias, where the onset is insidious, the progression is slow, and chronic leukemias are quite compatible with long life. Even without treatment, patients might live for a number of years. The other way of classifying leukemias is depending on the number of hematopoietic cell, a type of hematopoietic cell from which this malignancy arises. And as we all know, to understand leukemia, you must revise your hemopoiesis. As we all know, this is hematopoietic stem cells. Generally, it gives rise to two types of cells, two types of cell lineage. One is called myeloid, and the other is lymphoid. So these are only two lineages. The myeloid, this gives to a diverse type of cells at the end of the day. نتكلم عن different types of cells, neutrophils, basophils, monocytes, erythrocytes, platelets. These are all myeloid cells. While the lymphoid cell, the lymphoid stem cell will only give rise to the lymphoid cells. Lymphocytes are mainly either BT or natural killing and these things. And the B, as you shall see, it will further differentiate into plasma cells. So this عشان كده بنتكلم عن myeloid leukemias and lymphoid leukemias depending on the hematopoietic cells from which the malignancy arises. وبالتالي we have these four types. When you combine these two classifications, we have all these types. AML, ALL, CML, CLL اللي هنتكلم عنه بشيء من التفصيل. This is another diagram showing hematopoiesis. لكن here we want to relate it to leukemia formation. So if only these very early cells, the blood cells, they become neoplastic, then we get acute leukemias. AML, different types, and ALL. AML is acute myeloid, and this is acute lymphoblastic leukemia. If mature or maturing myeloid cells start leukogenesis, then you get CML, chronic myeloid leukemia, اللي هو mature or maturing. And this is important. When we're maturing in CML, we have to see left shift. Immature cells are characteristic.
السلام عليكم. Excuse me, Prof.
If it arises from mature lymphocyte, then it is CLL, and my multiple myeloma from plasma cells. حاجة مغطية علينا. So these are acute leukemias, chronic leukemias. Acute leukemias are acute lymphoblastic leukemia known as ALL, and acute myeloblastic leukemia known for short as AML, and chronic leukemia, these are CML and CLL. زي ما قلنا يعني this is just to compare and contrast between them. Poorly differentiated blood cells with acute leukemia, rapidly fatal outcome if untreated, and this is to be compared with well-differentiated cell population and associated with longer survival even without treatment. This is just examples. This is AML. These are immature cells. These are blast cells. And this is CML. All these cells are mature cells. These are mature neutrophils, mature monocytes, كده, mainly neutrophils. So these are mature. This is the essence of it. طبعا clinically it mimics a lot of conditions. Therefore, clinicians they need to differentiate leukemias from this disease, aplastic anemias, myelodysplastic syndromes, multiple myeloma, lymphomas, severe megaloblastic anemias, and leukemoid reaction. Leukemoid reaction is of special interest. The clinical features, this is just an overview. Clinical features, there are many, like they stem from two things only. If you understand the pathogenesis, then you can work out the clinical features. نحن قلنا this is a disease of bone marrow. You will have a leukemic cells proliferating, occupying the bone marrow, replacing the normal hematopoietic cells. With that, you will not have a functioning bone marrow, and then these patients will present with features of bone marrow failures. This could be in a form of anemia, thrombocytopenia, and loss of function of white cells. So they might come with features of anemia, bleeding tendencies, or abnormalities of white blood cells, either in mainly infection or could be in shape also. The other important pathogenetic cause of manifestation is infiltration of organs. You have a very big number of cells. They will fill the spaces allocated for them in the bone marrow, and then بيحصل spillage over. They will spill over. They will no longer remain in the bone marrow, so will go to other organs. So they infiltrate organs. وبالتالي the other presentation is organomegaly, and this is infiltration like splenomegaly, hepatomegaly, lymphadenopathy, leukocytosis, the infiltration of the circulation, and features like bone pain, meningeal irritation, oral thrush, chloromas. Chloromas, the other word is granulocytic sarcomas, are how you can have a leukemic mass in tissues. طيب مطلوب مننا شنو كويرك اب؟ مطلوب مننا to diagnose leukemia and to classify leukemia and to identify the cell of origin. بدل مطلوب مننا ان احنا في الميديكال بروفيشن or في اللابوراتوري سايد انه we need to diagnose and say this is leukemia. You say what type of leukemia is it? هذا الشيء. And then to نقول what type of cell of origin is. To do this, we need to do peripheral blood evaluation and then bone marrow evaluation. احنا بعدين انا هتكلم عن حكاية البريفرال blood دي لأن أنا I have a peripheral blood picture. This is a big problem we are facing. Then the other طبعا في other clinical side we need to treat. يعني after we diagnose كده we need to treat. وفي بعض الكلمات we need to know عشان to understand like remission. يعني the aim of treatment is to induce remission. Remission is absence of disease both clinical and hematological. يعني treat until the patient is symptom free, clinical is okay, and hematological is okay. The peripheral blood is okay, the bone marrow is normal. لكن في حاجة تانية بتصل لنا في حاجة اسمها minimal residual disease. يعني مرات بيكون there is few leukemic cells left behind that are not detectable by routine laboratory investigations. لكن they can cause relapse. Screen shared. وأهمية المينيمال ريزيدوال ديزيز لأنه في الكوز يعني دول أنت شخصوا عالجته تفتكر إنه بيجي أوكي لكن if there are still few leukemic cells left behind then they will cause a relapse. عندي مشكلة كده. طيب leukemia treatments collaborative is not a one man job. و many people they need to collaborate. وهو different lines of treatment, drugs and الآن بنتكلم عن targeted therapy and other diseases. The goal of treatment is to induce remission. Remission is usually induced by chemotherapeutic agents. A lot of drugs are used to induce remission. نحكي هذه عملية مشكلة يعني. هذا لقيت طريقة استخدم بتاعتها تاني الحين. البوينتر هنا بيكتبوا في الجهاز هنا غير حركة السلايد بس أنا ممكن أشكل الكيرسر لكن ده أنا كده قدام كده ماشي قدام فوق قدام Use remission to intensify therapy to consolidate and maintain. طيب usually use a combination of drugs عشان to avoid المشاكل بتاعة الريزيستنس وكده. والبون مارو ترانسبلانتيشن اللي هو عمل البتاع دي عشان تقول لنا خلاص كفاية. This is the end
في
of
لايف يعني لايف هاي
لكن بون مارو ترانسبلانتيشن طبعا بنتكلم عن ناو عن هيموبويتيك ستيم سيل ترانسبلانتيشن. This is another line of treatment. نمشي للسلايد اللي بعد البرزنتيشن. This is just an overview. نمشي بعدها Acute leukemias. هنا كده ولا كده فوق forward. I don't forward. طيب this is the second اللي هنتكلم عن acute leukemias. طيب يا جماعة نحن في هذا الجزء من السودان أكبر مورد للهيماتولوجيكال مالجنسيز في السودان. أنا صخرتم ضربوا لنا أنتم مش كل الهيماتولوجيال مالجنسي جاي من كردفان جاي من تسعير. هذا مش برا بس. طيب فابديميولوجيكالي عندنا مشكلة نحن we see a lot of cases of leukemias in this part of the country. المشكلة الحقيقية هو diagnosis of acute leukemias. It's difficult. Usually missed diagnosis باللابروتري براكتس اللي احنا شغالين بيه دول we will miss all cases of acute leukemias. And I will tell you why. طيب طبعا المالجنت ار بلاست. احنا قلنا الاماتور. Acute leukemias is clonal proliferation of blasts. وعشان تكواليفاي نسميهم acute leukemias القديم كان بيقولوا you need 30% of your blood cells to be blast in the bone marrow in the peripheral blood. أخيرا WHO قالت 20%. So it's no longer 30%. This is an old cutoff point. 20% now is enough. And as you see, we have AML and ALL. Again, the طبعا again بس عشان ترمي الناس هنا عشان acute leukemias اللي هو بيبدأ هنا مايلو بلاس برو مايلو سايز مايلو سايز ميتا مايلو سايز فوق دايما هنا هنتكلم في السرير الأوعية دي أو هنا طول الأوعية مشكلة هنا دايما. These are the cell of origin. They either start from blood cells or from myelocytes. نتكلم عن granulocytes. طبعا ال AML كان arise from other cell lineage يعني ممكن تجينا من الريد بلاد cells من المونوسايتس وكده. These are the red cells برضو early and early normal blasts. This is where we expect to have the site of origin of acute leukemias. This is just to make life easy. And the hematopoietic cells, إما lymphoid أو myeloid. If it arises from here, then we have ALL. If it arises from here, then we have AML. طيب ALL يا جماعة is the commonest acute leukemias in children. While AML is the commonest acute leukemia in adults. Etiology is the same. We have genetic factors. وبالتالي we see AML in a number of genetic syndromes like Down syndrome, Fanconi's anemia. And there is a genetic aberration underlying these things. لكن برضو acquired like myelodysplasia, chemotherapy, and chronic myeloproliferative disorders. دايما الأكوار دي بعملنا what we call acute secondary acute leukemias. اللي هما they all carry very bad prognosis. Acute leukemias نتكلم عن AML is a very diverse different types of leukemias. According to the old classification, we have 7 types. أنا يجي 9 وربع دول. But we classify acute leukemias with 2 types. نتكلم عن الFAB classification. FAB classification and WC classification. FAB classification is morphological classification. It depends on the morphology. And we have 8 types of AML. This is from 7 actually, from M1 to M0 with these different morphological characteristics. The WCO classification depends on cytogenetics. And the need for this is, يعني why do you classify? Basically, why do we need to classify diseases? عشان شنو? Generally speaking, why do we classified diseases. شباب يعني يس عشان تحطهم خيارات بتاعت علاج وخيارات بتاعت prognosis. فلقوا إن الفار classification morphological classification it doesn't fit very well with therapeutic options and prognosis. وبالتالي people shifted from FAB classification to WH classification which depends on cytogenetics. Cytogenetics is, what is cytogenetics? What is cytogenetics? This is morphology and this is cytogenetics. Cytogenetics يعني شنو؟ Chromosomal analysis. Chromosomal analysis like translocations, deletions, inversions كده. وبالتالي this is FAB classification for AML M0 to M1 and this is the WHO classification. WHO classification they classified into three main groups: AML with recurrent genetic abnormalities, AML with MDS related, or MDS therapy related, and MDS are not otherwise specified, and this is going to be classified according to morphology. When it comes to LL, برضه في FAB classification to L1, L2, and L3 morphologically, and then into WHO classification into ALL with the current genetic abnormalities, ALL not otherwise specified, and T cell ALL. Okay, forget about this. في بعض types of AML عندها very characteristic. M3 is very famous, both morphologically and cytologically. Morphologically هي promyelocytic عشان كده اسمها APL acute promyelocytic leukemia. clinically عندها حجوبة دي عشيان and bleeding tenderness. Cytologically عندها certain translocation نتكلم عن 15 17 وعندها good prognosis. AML 1 and 2 they characterized by supraosteal infiltration and AML 4 and 5 اللي هم دول monocytic monoblastic they are characterized by tissue infiltration. هنشوف صور. This is just remind you and clinical features mainly bone marrow failure, organomegaly, tissue infiltration, and increased cellular catabolism. This is, what is this? Purple. What is purple? Huh? Purple edition. Purple. يعني this is يعني ممكن العيان يجينا بس ببليدنج تندنس. و this is the most common presentation في الأكيوت leukemias. وهنا دي purple لكن the most common presentation usually people come with epistaxis and bleeding gum. This is an alarming خاصة الأطفال. أمهاتهم يجيبهم لأنه they have intractable epistaxis or intractable bleeding gums. لكن it could be any one of these. يعني this is purpura, this is bleedings here في الميوكوزا, oral mucosa. This is what is this? Gem hypertrophy. What type of leukemia is this? ML, M, M4, M5. M4, M5 بيجونا بجم hypertrophy. This is another bleeding tendency. Then we come to laboratory diagnosis. This is your concern. ممكن تلقى a lot of features. Anemia, thrombocytopenia, neutropenia. A white blood cell count in acute leukemia has no bearing, could be anything. يعني ممكن يكون high, normal or low. لكن هي أهم feature, أهم indicator of acute leukemia is circulating blood. يعني normally you should not see blast in peripheral blood. Presence of blast in peripheral blood is the first and the most sensitive indicator to acute leukemia. ما شاء الله. دي ما شاء الله. اوكي. يعني واقفين سيركيوليتنج بلاس. طيب السيركولار بس حشوفها وين؟ منو اللي بيعمل بريفرال بلاد؟ nobody does. ما قاعدين تعملوا بريفرال بلاد. ما تقول لي عن الله. ما خلاص يكون واحد. nobody does peripheral blood film. كل البريفرال بلاد فيلم ستجينا في الريبورتات دي مطبوخة. تبقى راكي؟ هذا عملية تمثال. وده الموضوع الأساسي أنا أهم موضوع لي في العناية ده إنه examination of peripheral blood. اللابوراتوري طبعا قلنا المورفولوجي اللي هو بون مارو خلاص، يعني يا بون مارو اسبيريشن يا بون مارو بايوبسي. في الغالب ما بنحتاج بايوبسي، لكن الأهم من كده أنت يونيك انك تعمل البريفرال بلاد عشان تشوف سيركيوليتنج بلاد. انا I've been practicing هنا for more than يعني انا 30 سنة ما جاني بريفرال بلاد أكبر ليه. عملوا تكنولوجيز قال لي في سيركيوليتنج بلاد نيفر. وده ليه؟ عشان كده انا قلت لك في مشكلة في تشخيص الاكيوت كل اللي ما ده ما كاونت. You can suspect it، لكن مشكلة في الاكيوت leukemias. وما لأنه مش لأنه ما probably people might have a difficulty in identifying blast، لكن الأهم من كده it's not done at all. أكبر 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 مصيبة جاتنا في البلد دي اللي ما يعرف بالأوتوماتيك كاونترز دي أكبر وباء، أحسن منه دينج وأحسن منه الكوليرا ذاته. طبعا you know this ما محتاج أتكلم فيه. This is صلاح and this is جمشيدي. طيب كده عشان شوية كده نرجع ده شنو يا جماعة؟ نذكر الناس بالبريفرال بلاد ده شنو؟ أقول أدميتي هنا؟ قاعدين نجيب شوية كده. I want to train your eyes in examining. What are you seeing here? ده أقدر أقول إيه؟ ما عدا الفرونت بنش اسمها داير منهم كلام. الفرونت بنش الأسئلة الأخيرة دي ممكن كده. دسوقي هتحرجهم لو عرفت هم يعني. أدميت. لو أنت عرفت هم عرفوها تبقى مصيبة كبيرة. ده شنو يعني؟ دي segmented just segmented normal segmented neutrophils. ودي hypo segmented. دي شنو؟ دي شنو؟ بلاس. what type of بلاس؟ طيب دي شنو؟ هم؟ nucleated vessels. طيب لو لقينا both immature red cells and immature white blood cells in a peripheral blood, what do we call this? The leukoerythrocyte picture. So this is. طيب لو لقينا leukoerythrocyte picture نفكر في شنو؟ يعني أنا to differentiate leukoerythrocyte picture is not a feature of leukemia. لو لقيت دي براها لو لقيت دي براها this is blast خلاص. لو لقيت دي براها nuclear access. لكن if you find them both then this is uh, You could histopathology picture. This is normal bone marrow. This is how the blast look like. You need to train your eyes to identify myeloid blast. هنشوف كثير منهم. This is what cells are these? Hmm? Blast. What type of blast? Hmm? Type addition. Type addition. Vacuoles. Blast. Cytoplasm is abundant, is eosinophilic, and vacuolated. What is this? This is a Yamaha L3. This is L3. What is L3? Huh? Burkitt lymphoma-like cells. They look like Burkitt lymphoma, like they are blasts. They are large, abundant cytoplasm, and the cytoplasm is vacuolated. What is this? This nothing. حاجة شنو؟ طبعا السيكولوجي إذا غلبتنا مورفولوجيكال، يعني خلاص غلبتنا مورفولوجيكال نفهم. Lymphoblast L2. This is L2. طيب, diagnosis of acute leukemias depends on عندنا four modalities. Morphology is one, cytochemistry is two, immunophenotyping is three, and cytogenetics is four. نحن الآن شغالين morphology mainly. نحن we can diagnose more than 90% of acute leukemias morphological. And كده morphology is important. Morphology. Again, morphology ده انت هتشوفه وين؟ جماعة these cell counters are stupid machines. They just count. They don't know morphology. Morphology is the art of hematology. Any fool can count. The problem is morphology. The only place where you see morphology in the peripheral blood. انا بقول الكلام ده لانه انا قاعد في الجامعه بدرسكم بقولوا على البريفرال بلاد تمشوا بره لما تتخرجوا nobody does peripheral blood. ويكتبوا لنا funny enough انه في السي بي سي تحت يقول لك البريفرال بلاد فيكر and they don't ما في سمير ينجروا عليه يقول لك نورموكونيك نورموسيتيك وكده وما عارف كده without seeing the morphology. Morphology is the art of hematology. طيب then نحن الحالات اللي بتغلبنا الجويرية ما عرفناها مورفولوجيا كان ممكن نستخدم السيتوكيمستري والإيميونوفينوتايبنج والسيتوجينetics either for identification or for classification. Who are them? Who are these? Hmm? Who are they? منو؟ ها؟ جميل. ايوه عند في ناس وبعدين دول الاثنين دول انا استاذات في كلية المختبرات. دي نجاة عبد الرحمن الحياة من على البعد وانا معزيها في وفاة والدها، ودي حكمة. عرفتوهم كيف؟ عرفتوهم كيف الناس دول؟ عرفتوهم كيف الناس اللي عرفوهم؟ ها؟ عشان شفت المورفولوجي. عشان شفت المورفولوجي would never know them without يعني knowing their morphology. This is the beauty of morphology. يعني المشي ممكن يقول لك دير ثلاثة، لكن هو will never tell you who are they. بيجاوبوا هنا فوق. آه. آه. تعالى نشوف. أيوه. بيدوك هنا. كويس تمام. اوكي نرجع لصورتنا يا جماعة. This is أهمية المورفولوجي. أنا دار الناس لو طلعوا من الورشة دي بمعلومة واحدة مهمة. جماعة never report a hemogram without doing a peripheral blood film and examining it. بيجونا حالات بتاع سيكلس، بيجونا suspected leukemias في البون مرة، نعمل البون مرة ونلقوا سيكلس. ليه؟ لأنه حسبوا الوايت بلاد created red cells كلها اتحسبت لهم وايت سيلز وجاي يجوا في المعمل. عيب نشخص سيكل سيل من البوم ماله. It has to be diagnosed with a peripheral blood